Valentina, ¿cómo estás?
Hello, hello. How
Come
are you?
in, come in.
Thank you.
Welcome to the Tributo house, the house of Tributo. Come in, come.
Thank you.
How are you?
I'm great.
Come on, come in, let's go.
When did you arrive to Bogota?
Yesterday, I came in yesterday and I'm here visiting the Tributo house. Come on in.
Fantastic.
Come in, come in. So we are here in the Tributo houses where all the magic happens.
Wow,
Yeah,
it seems
so-
amazing. Can you show us a little bit?
Yeah, come in, come in. So everybody is doing their part. So everybody's working quietly. We're making garments. Some people are putting in rods. Some of them doing a little seamstress. Come.
Wow. So, for the people who might not know you, who are you in 5 words?
Who am I?
Yes.
I'm Dr. Nicholas Jones, Dr. Nip and Tuck. I'm the people's plastic surgeon from New Orleans. My practice is in Atlanta, Georgia.
When did you realize you wanted to be a plastic surgeon?
I've always wanted to be a plastic surgeon. So my mom always told me that I was going to be a doctor when I was growing up. And so once you keep hearing something over and over again, it sticks. And plastic surgery was just a good fit for me.
What's the most performed plastic surgery you do?
Most performed, come with me. I do a lot of different procedures. I do a lot of liposuction, but I would say probably the most common is abdominoplasties and high definition lipo.
Men or women?
Women, I would say about 80% of my patients are women, but times are different, and men are now, it's becoming more acceptable for men to have plastic surgery. Come.
What role do you believe a Faja plays in achieving the best surgical outcomes?
I didn't hear you. Say that again.
What role do you believe a Faja plays in achieving the best surgical outcomes?
Oh, Fajas. Fajas are really important. So Fajas help with the shape. It also helps with the swelling and helps mold the patients. And I think it makes patients more comfortable. And I just feel like they get a better overall result. Otherwise, no garment. You just have lots of swelling and indurated skin. It's part of the process. So coming here, we got a team. Oh, yeah, we have a nice.
So,
we have
Faja with
beautiful
rods or no rods?
rods or no rods? It really depends on the patient. Early on, I don't like rods because they can be a little bit stiff. And also during the healing process, you don't want anything too rigid because it can end up injuring the skin.
Got it, got it, got it. What do you think about that hot pink Faja?
Hot pink. Oh, this is a beautiful faja. But I personally, I like black because patients they bleed, they have lots of oozing, and I don't want them to just aesthetically. It just works for me. Come,
Got
keep
it.
going, come. All right, come on.
What makes a Faja perfect?
Huh?
What makes a perfect Faja?
A perfect faja, comfort, great fit. I like let's keep going. Fajas that are easy to take off and on, comfort, and patients, you have to use the bathroom, easy accessible, that can be washed, and the material.
Okay, so what is your best advice for patients about post-surgical care?
Post-surgical care, make sure you get your instructions, make sure you review them, listen to your surgeon, and just realize that it's a process. It's not something that just happens overnight. It's a continual process, and it all starts when you meet your surgeon and go over the expectations.
What do you say to your patient that doesn't want to wear a Faja?
They're not the patient for me.
Great. So what is the biggest misconceptions patients have about compression garments?
That's a great question. I think one of the biggest misconceptions is that they think that tight is works for everyone. Like it doesn't necessarily. You don't really need a tight garment, especially when you're just had surgery. You want to kind of gradually get into a tighter garment, and also, not all fajas are made the same. You can't just go into Amazon and just get a garment like that. That's not going to work, and patients really don't understand how important the aftercare is.
What is going on there? Can you draw something there?
Oh, what's going on right here? So this is part of the process. This is a little template or a cutout, and basically you come in here and you design a template and cut it out to this is like the beginning part of creating the garment. So there's custom garments, and then there's
Ready-to-wear garments.
ready-to-wear garments. How did you know that?
Well, I might have had some experience.
Okay, yeah. So there's ready-to-wear, and then there's custom. Custom is made to fit for a specific body. Like if you have a longer torso or your legs are really long, they have a custom garment that's made for you. All right.
So, what is the most exciting part of being a plastic surgeon?
The most exciting part of being a plastic surgeon is I can have a direct impact on my patients. So I can use my creativity and as well as the science and get them the best result, and also more importantly, bring them back to where they were before, install the confidence, and they go back out and be productive citizens. Come on, let's come in here.
So, this is about personal taste. Black or dark brown?
For me, which one do I like? I like
Yeah.
black. Again, immediately after surgery, patients have lots of drainage, and so I don't want them to get all squirmish. The black kind of hides the drainage more.
Got it. What about mommy makeover or BBL?
Mommy makeover or BBL, which one do I like?
Yeah,
I
what
like
is more
them both.
trendy among your patients?
But I think mommy makeovers are more kind of like a big deal. Like they get a bigger bang, because most of the time those patients, they're getting something done to their breasts as well as their body. So it's a more complete transformation.
Wow,
Yeah.
amazing job, I will say.
Yeah.
But I have a question. How do you balance patient desires with with your professional judgment?
How do I balance their desires? So I think the most important thing is communication. So communication, I know their expectation, and they know what I can or cannot do. And sometimes that may mean turning a patient away, or telling them, hey, you need to lose weight before surgery, or breaking the surgery down into stages. Like maybe you get your abdominoplasty, and then you come back 3 to 6 months later, and we do the second stage.
How do you handle patient expectations?
Communication, just same thing.
Yeah.
It's really just talking to the patients and making sure that their desire or their expected outcome, I can deliver it. Now, some patients I may not be able to deliver. I may not be the surgeon for them, and they may not be the patient for me.
You have a great personality. If you weren't a plastic surgeon, what other profession would you have pursued?
Oh my gosh. If I wasn't a plastic surgeon, lots of things. A basketball coach. I feel like I would have been a great film director. I would be a great chef.
Wow. What is
Lots
your
of things.
favorite dish to cook?
My favorite dish? I don't really have one. I just love to eat. I like to try different things. But right now, I would probably say, what am I feeling right now? Ceviche. Ceviche, yeah.
Have you tried Peruvian ceviche?
Peruvian ceviche, yeah. You know what? I've been to Colombia one other time, and yeah, I've had some Peruvian ceviche. What about you? Have you had any?
I love Peruvian ceviche. I live in Peru for some time, so I love it.
Come on up. This is the house of Tributo. We're gonna go upstairs.
Tell me, what is the biggest myth about plastic surgery?
The biggest myth? That's a good question. I would say one big myth is like patients feel that, or their expectation, like they may send us a picture and they may think that they can end up looking like Kim Kardashian, but they may not have a Kim Kardashian frame. All right.
What do you say about surgeons that doesn't believe in compression garments after plastic surgery?
Physicians or surgeons who don't believe in garments, I think it's just unfortunate. But everybody practices a different way, and what works for me may not work for someone else. But I think we should all continue to be open, because the technology changes, and at the end of the day, you should want to do what's best for your patients.
What's your opinion on Tributo's Fajas?
Tributo, come with me, come with me. I believe that, I think Tributo is a great garment. I think it has a great fit. They have great customer service, and as a surgeon, being able to interact with the staff and make subtle changes that will benefit my patients, I think is really important. And I also like the fact that it's a family business, kind of started from the ground up. So I think that just adds a little special character and a little bit more makes things a little bit more personal.
Thank you for that. And just to end this interview, tell us a hidden talent that people doesn't know you have.
A hidden talent that I have, like I said, I coached basketball before. Like I coached when I first moved to Atlanta. The first year I was there, I coached a freshman basketball team at Decatur High School. So I think I have great coaching skills. So if there's any like NFL team, NBA team, college team, and they're looking for a general manager or a coach, and they're willing to take on a plastic surgeon, I'm their guy.
That's awesome. Thank you for your questions and your answers. It was amazing to meet you more.
Okay, perfect. Let me just show you one more thing. I just want to share. I just want you to see this. You see this? Can you read to me what that says?
May the booty get fatter and the belly flatter.
And that's all I ever wanted as a plastic surgeon.